Hey everybody, this is Dr. Nick with the Springfield Wellness Center. Today we're going to be talking about whiplash and what are some of the things that we can do in the office to help combat that. Today we're going to be, Liz is going to be helping me out, and we're actually going to be showing what you can do to help minimize the effects if you are in a rear end collision accident. So whiplash is it's a pretty bad thing that can happen to your spine in an accident. The rear end collision accident is usually either the rear end or the head-on collision are the two worst types of accidents you can have, just because it does cause so much damage in your spine and in the muscles that support your spine. But most people are getting into rear end collision accidents, and we see quite a few of those in the office. What happens is when you get hit from behind, the driver's head or the passenger's head will go forward first, and then it'll go back. Now, when it goes back, what we want to make sure of is that the headpiece is as high as it can be to where the head doesn't go over the headrest. So if the headrest is low, it can, even in an accident, even though this one is actually in not too bad of a position, in an accident, her head could actually lift up and go over it, depending on how much force is put into the car. Now, what we want to do is make sure that this is as high as possible so that the head solidly hits back on it and doesn't ramp back over. When it ramps back over, that's when it puts a lot of strain on the muscles, the ligaments, and also the joints. So what happens with the spine itself when you do get whiplash is that the whiplash tends to straighten out the spine. And this is called ramrod spine. So this is where the spine loses its curve. Now the curve is important because it helps distribute the weight throughout all the different joints of the cervical spine. When we get ramrod spine, it actually straightens them out like that, so it's all straight up and down. And the reason why that happens is because the muscles become so tense and so tight that it forces that up and down nature of the spine. Now, short term, this isn't that much of a problem. Long term though, if this doesn't get treated, and this is why I tell anyone who's been into a car accident, make sure that you see a chiropractor. If you've gone to the hospital, they're just making sure that your head's not going to fall off, or that you don't have bleeding in your brain, or there's something that's life-threatening or that needs to have surgery. But if they decide that it's just a sprain strain or it's just whiplash, they're going to send you home with muscle relaxants and painkillers, and that's not going to fix this problem. So the long-term effects is if this stays straight up and down, it starts to put a lot of stress on the discs, which are the shock absorbers of your system. If those start to deteriorate and get smaller, then the holes that the nerves come out of can do that as well. And also, if these joints aren't moving the way that they're supposed to, then that's going to create a problem, because the brain says if those joints aren't moving the way that they're supposed to, they must not need to move. That's when it starts to lay down more bone, which becomes arthritis. We've had so many cases in our office where 20 years after an accident, they're coming in and they're saying, I didn't have neck pain but until this accident happened, and I've had neck pain ever since, and now it's a chronic issue. So make sure that when you get into an accident, you're going and getting checked by a chiropractor right away. So what do we do for the joints? There's a couple different things that we do in the office. We're going to be focusing on the joints themselves with the adjustment, and then the muscles, any tight muscles, we're going to be working with our massage therapist to make sure that those are relaxed, and then any weak muscles, we're going to be working with Nancy in our functional fitness center to make sure that we're getting the motion and the strength back into the muscles. But with the joints themselves, that adjustment is so crucial. If there are areas that have gotten out of alignment and are stuck out of alignment, until you get those back into alignment with the chiropractic adjustment, they're going to continue to stay out of alignment. They're going to not move the way they're supposed to. Your function is going to go down. It's going to create problems down the road, and it's definitely an important thing to make sure that you get checked out and make sure that your spine is functional. So we're going to head back inside, and we'll talk about a couple things we can do in the PT room. So we have a lot of different modalities that we can use in the office to help with pain. There are three of which that I focus on when it comes to whiplash. So obviously there's a lot of muscle tension and there's a lot of inflammation going on in the muscles around the spine when there's a whiplash incident. We also may have some disc involvement, so we're going to talk about a couple different techniques that we can use. So the first one that we use is our cervical decompression table, and this is basically mechanical traction that's going to pull and then relax. And what this does is it has a couple of rubber bumpers that go right at the base of the skull, and then this straps in your head, and then this pulls the headpiece up and then slides down, pulls it up and slides down. So whenever there's any kind of disc bulge or disc rupture from a whiplash accident or an auto accident, this is a really good piece to use. It's pretty comfortable. It usually doesn't cause any pain. It usually feels like a good stretch, but we also have a button to hit in case it does cause any problems. So that's what we would use if there's any kind of disc irritation. With a whiplash accident, there's a lot of damage to the soft tissues that surround the spine. So with the muscles, we're going to be dealing with a lot of muscle tension. So what we want to do is use our electrical stim, which is similar to a TENS unit if you've ever used one of those. And what this is, we put 4 pads around the area that is a problem, and these pads conduct some electrical current into the muscles, and what it does is it helps to break up the muscles and also relieve some pain. So it really just feels like a tingle, feels like a nice gentle massage, but it's working on the muscles themselves to help break up some of that muscle tension and reduce some of that pain. So while you're on it, we usually do this for about 10 to 15 minutes, and then while you're on there, we put the ice on. Now, ice is one thing I do want to talk about. It's something you absolutely should be doing at home to decrease the inflammation that is caused from the whiplash. Most people don't have symptoms right away. They usually tend to set in over the next 24 to 72 hours. So you want to make sure that you're icing immediately to help fight that inflammation process as much as possible. So make sure you're doing 10 minutes on, 10 minutes off, and put a damp rag in between the ice and your skin just so that it penetrates a little bit deeper. So the other thing that we're going to be doing while Pat is lying here is we're going to be talking about our laser. And our laser is a deep tissue laser, which actually works with light. So ultrasound is what we used to use to help to decrease inflammation in whiplash accidents. And ultrasound works by heating up the tissue. And that's how it stimulates the healing process. With a deep tissue laser, it actually uses light to get down to the cellular level and stimulate healing that way. And so it's a lot more effective than the ultrasound, works a lot faster, and has more penetration. So what we would be doing is working all along the muscles, along the cervical spine, and then down into the traps as well. And we're going to be doing both sides of the neck. And normally with the neck, it takes about anywhere from 5 to 7 minutes. So it's not a real long therapy, but it works really well. So those are the different things that we can do in our physical therapy department to try to help decrease some of the symptoms, some of the inflammation, and some of the muscle tension.
Extension of the spine will help bring oxygen. Hi, this is Nancy Thompson, the Functional Fitness Specialist at the Springfield Wellness Center, talking to you today about whiplash and Fitbit tips to help alleviate symptoms of whiplash. Often after an accident, symptoms of whiplash don't even show up maybe till the next day or days later. And after you've been evaluated by your doctor, what they're probably going to tell you is to go ahead and get your neck moving in a safe way. So I'm going to show you 3 moves that will help gradually, eventually help you alleviate the symptoms and maybe even strengthen your neck for the future. The progression on this for some people, if they're really tender, may be to start in a lying position to do these exercises. So I'm going to start there. You can recline and have your back of your head rested to do the first exercise, chin retractions or chin tucks or head retractions. So we want to pull the chin back towards the neck and then move it away from the neck and then pull it in towards the neck. You can stay in these very simple moves for about 5 seconds before you move into the opposing direction, and do that for about 5 to 10 reps. To have that in the seated position, you would want to move the chin away from the neck and pull the chin in towards the neck. And that's a nice, gentle, easy way to get that neck moving to prevent stiffness from setting in, from immobility. So we always want to get the neck moving as soon as possible after the accident. The next move you'll want to take is a rotational move, a head rotation, where you'll want to make sure you have your shoulder blades down, the ears away from the shoulders, and look over your shoulder stretching the neck in a rotational way, staying here for 5 seconds, and then making sure you do it evenly to the other side. And you want to do that about 5 to 10 times as well. And then the third move that you'd want to make is a side or lateral motion to get those muscles around your neck stretched. And as long as, again, it doesn't cause any severe discomfort, we'll want to take, again, keeping your shoulder blades down, move the ear towards the shoulder, staying here, breathing for about 5 seconds, coming back to center, making sure you have a long neck, and then going to the other side for 5 to 10 seconds. And doing that for 5 to 10 reps. And a few times a day isn't too often when you're dealing with trying to improve mobility of your neck and reduce the symptoms of whiplash. So that's something you can safely do as soon as possible after the accident. This is Nancy Thompson, your functional fitness specialist, today talking to you about exercising to alleviate the symptoms of whiplash. Have a great day.
So the third thing that we really focus on in the office with whiplash accidents is the muscles along the spine. So we're dealing with muscle tension and also muscle weakness. So the first one is the muscle tension. That's probably the most immediate problem because what we talked about earlier in the video, the muscle tightness is what's causing that ramrod spine. In case you didn't see the earlier part of the video, A, I suggest you to go check it out, but B, what ramrod spine is where the curve of the neck, which is normally like this, straightens out. And the reason it straightens out is because those muscles become so tense along the spine. If we can get those muscles to relax, the curve is allowed to come back into the spine. Now that curve is so important because it spreads the weight out throughout the cervical spine. If it's straight up and down, you tend to get a lot of pressure on the base of where the spine is straightened out, which is usually at the base of your cervical spine or of your neck. And that's when people 10, 15, 20 years down the road start to feel problems and start to have chronic issues because their discs have started to degenerate because we never got that curve back into their neck. So after the whiplash accident, it's really important to make sure, it's a reason why you need to be getting checked out to see what can be done to help with that. So in our office, what we do about the muscle tension is we put you with our massage therapist. The doctors work hand in hand with the massage therapist who are really skilled dealing with a lot of auto accident cases, dealing with whiplash treatment, and they can help those muscles start to relax. It allows the adjustment to be more effective as well as allow that curve to start to come back into the spine. The second part that we really focus on is the muscle weakness. Now we have a 2,000 square foot functional fitness facility in our office and a personal trainer, Nancy, who again is well trained on how to deal with auto accidents and how to deal with whiplash injuries. And again, the doctors work hand in hand with Nancy as well as the massage therapist. So she actually shot a video this week talking about some different stretches that can be done. So we're making sure early on in the whiplash treatment that we're doing range of motion exercises. That's number one. We've got to get the range of motion back into the spine. Movement is life, and that is true in your spine especially. So making sure that everything's moving the way it's supposed to, and then once we start to get that range of motion back, starting to add in some strengthening exercises to strengthen any muscles that might have gotten weak in the meantime. Now, there are some ligaments that tend to get stretched out in whiplash, so we want to make sure that those are, the inflammation process that we were talking about earlier, we want to make sure that we're decreasing that inflammation as much as possible. But by strengthening those muscles, if we do have any ligament laxity, the muscle strengthening is going to be really important to make sure that there's not too much motion going on in your spine in the long term. So if you have any questions or if you want to find out more about whiplash or how we treat it in the office, make sure you head over to wellnessspringfield.com and or give us a call at the office. It's 726-0422. Thanks a lot.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.